Digestive pains are your body's way of signaling something is not right, and you have to act on it. Unanswered questions about your digestive pains are actually an opportunity for you to explore your options. And that's what we're going to focus on today. What are your options for healing your digestive system? For those of you who are new, welcome to the Naria Lemaire Show, and I'm your host, Naria. Today we're going to talk all about gut health. I have a great episode that will focus on venturing out into functional testing to treat digestive issues. But first, I want to share a functional story with one of my clients dealing with SIBO. This individual actually went to 3 GI doctors, and they were not able to resolve his gut issues. He found me on his Instagram, and then he says, you're talking about functional testing. What is that? We did the functional test. We saw signs of SIBO. He took that test to his GI doctors. His GI doctors acted on it, which is huge. This is really important, really, really important. They acted on it and started helping collaborate the treatment for SIBO. So now when he goes to the hospital, the doctor, or any other appointments, and the nurses and doctors say, see SIBO, and they say, what's SIBO? My client is actually now educating, and that could be you. First, I want to talk about GI testing. This is what most people think when they go to their doctor for digestive complaints like bloating, heartburn, abdominal pain. This digestive testing is typically performed in conventional medical settings and may include conditions or procedures like endoscopies, colonoscopies, and stool tests. These tests from your GI doctor are actually to identify structural issues, infections, and serious conditions like ulcerative colitis or ulcers and polyps. We don't want those. We need to make sure that we let our GI doctor rule those things out. And examples of GI tests also can include reviewing for H. pylori, testing for stomach ulcers, and CT scans. All these tests check for abnormalities. These tests are excellent in diagnosing acute conditions and structural issues that might require medical intervention. But here's the thing, friends. If your tests come back normal, but you're still experiencing digestive issues, this is where functional testing come into play. And that's where I come into your life. You see, functional testing takes a different approach. Instead of looking only for diseases and structural issues, functional testing looks at the root cause, the symptoms, and how your body is functioning as a whole. These tests are often used in functional medicine to get more of a comprehensive picture of your gut health. There are different functional stool tests, and depending on which one you choose and which one your provider sends, functional testing might include stool testing. It can analyze your gut microbiome, digestive enzymes, inflammation, and even if there's harmful bacteria and viruses. We might also look at food sensitivities, organic acid tests, or even SIBO breath tests to explore the underlying imbalance contributing to your gut issues. You see, the goal here isn't to just name a disease, but to find the imbalance and create a tailored plan to restore your gut. So what's the main difference between a functional approach and a conventional approach? Tests from your GI doctors are more diagnostic and focuses on underlying diseases and structural problems. On the other hand, functional medicine is more investigative, helping us uncover why you're experiencing those symptoms. I always tell my clients doing functional medicine, I feel like a detective. I have to really explore, I have to connect the dots to really understand why is your body reacting a certain way, why the body can't digest the food, where is the problem starting? Is it in the oral cavity? Is it the stomach acid issue? Is it a gallbladder issue? Where is the problem? And that takes detective work. Now, another example, a GI test might confirm you don't have a bacterial infection, while a functional stool test might reveal overgrowth of less beneficial microbes or low digestive enzymes that are still contributing to your discomfort. These two tests are not mutually exclusive. In fact, they work best together, meaning it is best for you to work with your GI doctor and your functional provider. Integrative medicine can be a game changer. Don't try to put them in their own boat. Think, I can benefit from both. So when I'm giving you different options, don't just go to one, but consider both of them because they both will give you a lot of insight, especially if one has not resolved your issues. But how do you know which test is best for you? Guys, I know the struggle. Trust me. Now, if you have certain symptoms like blood in your stool, significant weight loss, chronic pain, changes in your bowel pattern, this is a high indication that you need to go to your GI doctor for them to do their thing. The GI doctor does need to rule out serious conditions such as colon cancer, polyps, ulcers. Functional testing is ideal if you've already gone to your GI doctor and you still don't have answers, or you're looking to optimize your gut health and really be preventative. Ultimately, both of these types of tests have their own place, and combining insights from both will give you a better treatment plan. When I work with individuals, about 99% of the time, I ask them to go to their GI doctor, do the colonoscopy, endoscopy, the CT scans, get all of that done. That is the scope of the GI doctor, and they do need to do those things. When they're done and they grab all that information and all that data, then they bring it to me. I'll review the doctor's notes, I'll review the medical diagnosis, the medications, and I do what's in my scope of practice as a dietitian that practices functional medicine. I go on and I do the functional test and I combine these two things. That's when I see the best results. Now, does that mean you have to approach it that way? You don't. Every provider is different. From my experience working with thousands of people with a lot of different GI issues and digestive problems, I can tell you that this approach, the integrative approach, has worked the best because we get to really look at the whole picture versus just narrowing it down and just focusing on one thing. We want to really look at the whole picture because the goal is to get you feeling better as soon as possible. And when the doctors have done their job and they've outruled everything and they've written down their medical diagnosis, I come in as a dietitian, I read that and I create your game plan. And many other times, my clients have to go with multiple GI doctors to get different opinions to look at a bigger picture of their problem. Remember, you can always get second opinions, especially if you don't feel comfortable with maybe how someone treats you or their action plan. Always get second opinions. For the most part, most of my clients have been to at least 2 GI doctors and at least one functional provider. But many times a functional provider they hired was not a gut specialist. It could have been a naturopathic doctor, very often a chiropractor, which practices functional medicine, but they don't specialize in the gut. And I can tell you as a gut specialist that working on the gut and specializing in the gut takes a lot of time and a lot of research. In short, you do have options. You don't only have to go with your GI doctor. You can actually combine with a functional provider like myself and do integrative medicine, which again has worked so good for many of my clients. I hope this helps break it down for you and you feel more confident about the options you have to review your gut. If you're dealing with digestive issues and want a personalized approach, functional testing might be the next step for you. Once you decide you may want to go with functional testing, you have to decide what provider you want to go with. Remember, a gut specialist, and also consider what functional stool test they're using. Different functional stool tests may show different results. And make sure to ask your provider, what does that functional stool test show? What will it reveal? If you found this video helpful, please don't forget to like, subscribe, and share it with individuals who may be dealing with digestive issues and may not know their options. And if you're ready to take the next step and take control of your gut health, check out my website below to learn more about how we can work together. Thanks for watching, and I'll see you on the next episode.